Hi everyone. Our group today will present you the strategy for UFB in the New Zealand health sector. Let me first introduce our group. We have Gloria, Suraj, and me, Gena. We have quite an international lineup here. We have Russia, India, and China, so we only miss a team member from Brazil to be called the Big Four group. Firstly, I will give you an overview of what we will be talking about. First, we will see at the problems that New Zealand have in health sector. So why do we need some health here in the first place? Then we will consider the type of help that UFB can offer to health sector. And next, how this can be done. So what are the technologies that are enabled by UFB? Then we will take a look at the status and the way the health sector preparing for these future technologies. We'll provide you with some examples, and then we'll come to conclusion. Now I will hand over to Gloria, so he will tell us about the problems and their possible solutions.
I'll give you an example at the beginning. In Australia, there is a car accident victim. They need their clinic for their injured arms, but it's far away to get the treatment. So he just goes back home with their arm exercise machine, and the machine is remoted by his specialist, and the specialist can distance control the machine to see whether their customer's situation, and to get their treatment to him. How about the New Zealand? Like, the sector is a primary rollout of the UFB with a policy goal to get success in 2015. And at that moment, over 90% of the patients will get a very good treatment by the primary health sector, such as the doctor, the nurse, the pharmacist, and extra. However, until now, because of the limitation of their connection and the collaboration, so their technology is not available, can't be run properly at the moment. And New Zealand also faces the same problem as others, like their demographic changes, their aging changes, and to this factor, like the demand of the health treatment is increased, but they don't have enough supplement to satisfy this amount of their demand. And also the cost of their their health center is very expensive. And the government would like to solve the problem. So in 2009, there are policy introduced to New Zealanders. It aims to build a better, sooner, and more convenient health services to their patients. And there are several aims of it. The first one is they want to put their patient in a very centric situation, and to provide them the better service and the system. And the second one is they want to coordinate their health center close to their house, so the demand of their hospital will reduce. And then they want to make sure all their workforce can meet their demand. And their vision of their policy is to achieve a high-quality health care and improve the patient safety. By 2014, New Zealanders will have a core set of their personal health information available electronically to them, and their treatment provided regardless of the setting at their access. And there are some explanation about it. The first one is the the patient's information will record electronically, and the second is their personal information can be used among the different different element of these sectors. And the third is the patient itself will get more involved in the data information collection and usage. And the fourth is the information can be used in different the information can be used in different situations, different requirements. And finally, I will discuss the 4 principles of the version. The first one is to put the patient in a centric situation and to make their information electronically can be shared and can be used by different elements of this community. And the second one is the health worker and support carer should be ongoingly to care the person. And thirdly, the clinic should be integral development and to provide the ongoing solutions. And fourthly, is the community must understanding and support the ongoing solution and can access and electronically to care about the patient.
Okay, so now Gloria explained us what are the problems and how UFB and where UFB comes to help in solving it. And now I will tell about the future technologies that are only enabled with the help of UFB and that will not be available otherwise. All these technologies have a requirement of very stable and high capacity communication infrastructure, as well as secure information systems that can also be only available if sufficient infrastructure in terms of connectivity is provided. So first we will start with telesurgery, which is a fascinating technology that provides the ability for a surgeon to operate a patient remotely. In these cases, actually, physical distance between the surgeon and the patient doesn't matter. It can be meters as well as it can be as far as thousands of kilometers. So what it gives us is that a patient can get services from highly trained specialists from anywhere, nationwide or overseas, from whatever, given the infrastructure is provided. So there's no need to transportation of patients that need emergency care and no need for surgeons to travel. So it really saves lives and it saves money. Next important step in the infrastructure is the electronic health records. This is crucial for the health systems because it is very important that every health worker have access to every patient information from anywhere, regardless of what exactly health institution they belong to. Of course, provided that they have sufficient access rights. Next technology is electronic transfer of advanced health images. Now we have a lot of scanning medical equipment that requires quite a storage space, and it provides a lot of amount of information. So we need a good connectivity, a good bandwidth of connection, and secure means to transfer all this information from one institution to the other and to store it in some centralized space. Another very important thing is that now with the help of UFB, patients can be self-monitored by using the telehealth technology. This means that they can get treatment not leaving the house, because some units, electronic tele units, can be installed right in the home, and they can get help from the specialist just without leaving the premises. So actually this does a great thing, because it frees up space in the hospitals for people who really need it and reduces the queues. The next one is electronic prescriptions. This is really an important thing, because instead of writing the prescription on a piece of paper and going to pharmacy with it, we would have a centralized, very secure and efficient electronic system. And yeah, there's no more need for chicken scratch prescriptions that no one can read except for the doctors themselves. And finally, the high quality connectivity provides for high definition video conferencing, which means that doctors can have meetings and consiliums right at their working place without leaving their health institution. So here we can greatly save time and the money on business travels. So this is about the technologies of the future. And now I will ask Suraj to tell us about the present situation and how things are going. How do we prepare for this bright future?
Thanks again. Hey everyone. So everybody knows that there's this loud noise about this UFB and things like that, but how are we exactly preparing towards this? What steps are we taking to welcome such a huge venture by the government? So Alcatel-Lucent came up with their own document of UFB, and they have come up with something called as the health list. It's like a checklist. So with respect to the healthcare, they come with the checklist, and the first part of the checklist is to establish an online database. So what this database is going to do is it's going to have all patient information and records in one place. So all health institutions have access to one single database with all information on it, so that reduces redundancy of information, that gets faster access, and most importantly, it gives a more collaborative approach towards it. The second one is to establish correct security systems. It's healthcare, so healthcare is very there are sensitive information, like if somebody gets treated for what he doesn't actually have any issue with, it could be fatal. So you need to make sure the security systems are in place. And the next one, this is related to more so public acceptance level. Like we need to make sure we tell the people we educate the people and let them know what they're going to benefit of this telehealth and of different applications regarding future health sciences. And we need to make them realize that this is being done on a totally patient-centric model and people-centric model, and it's going to be they who are going to be on the top priority and not the health institutes and etc. And sorry. Sorry, I don't know how to use this thing. Anyways, the fourth one would be that the health providers can actually have do a research or study about the different marketing strategies being provided by different telecom services, and they can choose on which one suits them and their purposes the best. So of course, in such a huge project, there are going to be complexities. So that's what I'm going to come at next. And the first complexity is regarding information systems. It's all informations all core health information, patient information, everything is going to be stored in some particular system, right? It's not going to be kept in the air. So and these systems can be on a national level or on a regional level. It can be that it can be like maybe a small regional institution has some amount of data in it, and even that's an information system as well. But the complexity comes in where we need to connect these information systems together, and this is where UFB kicks in and provides a better communicative approach, faster with the amount of the download speed and upload speed is giving. And the next one is regarding the patient-centric model. Like everybody knows it's patient-centric, but how exactly can we make it patient-centric? And if we do make it patient-centric, then how will we be able to give the patients the information? Like how will they be able to view the disseminated information by health sciences? And that's the solution for that as of now is web portals and things like that, but the technology is always open. This is one example what the government is coming up with. It's called a health provider index. It's been there before as well, but they're coming up with a new system of the health provider index. Health provider index is basically again a database, but it's going to have all the data of the registered practitioners in and around in New Zealand basically. So the new system is going to be an online system. It's going to have more capacity, and it's going to have it's going to include other institutes as well, other small regional institutes, community hospitals and things like that. So the UFB is going to be a huge it's going to have a huge effect on it, and it's going to be significant. Yeah. And the last this is a small venture which it's like a case study. It's called teledomoscopy. It's basically related to electronic transfer of images, and this was done in the Waikato District Hospital, and the result was such that there is not much of a difference. It's exactly the same if you send an electronic image, and face-to-face consultation is going to be the same. So this is just a proof that health like future health applications such as this are effective, and maybe we can use this as to overcome public acceptance issues, for example. So to conclude, sorry again, I don't know this topic. Anyways, conclusion, let's say health sector, that's common, like everybody knows that it's going to be one of the highest priorities. So people are looking towards the UFB to give solutions for problems in everything actually, but in our case we would say health. UFB is a prerequisite for advanced healthcare technologies, like I said, the database, establishing the online database. If you have with UFB kicking in, that can stand as a basic platform for further technologies to come, and health sector is being actively prepared for UFB, like how I said regarding the sector. So thank you. Any questions?
I have a question.
Yeah.
So I think no matter how advanced or how powerful the system is, the end user should be a crucial part of the implementation of that system. So did you consider about the medical experts, their attitude, and as well as the training cost, education cost from them? Because as far as I know, a lot of medical experts are refusing to use those high technology to deploy it into their routine work. So have you considered about that?
Yeah, I believe that the problem that you have mentioned is about a part of the preparation to UFB that Suraj was talking about. So this definitely should be addressed, because technology provides us with availability of these future things. But another challenge is to make them be used by the actual staff. So yes, you're right, it's one of the steps that should be taken during the preparation of UFB.
Do you have any information right now, to what extent the local doctors of New Zealand accept the new technologies as well as those.
They are taking up initiatives, like how I said, like in the Waikato district, they are taking up initiatives, but it basically comes back, what you're saying comes down again to public acceptance and making people use and believe in such technologies. So that's going to take time, and that matters on how well we can educate people and make them realize that this is good. So
it's like a qualitative variable on how people accept. So we cannot give you figures like we have accepted it for 95% because there's no such thing as acceptance.
It's people mentality and psychology, so it depends on.
But it's on the track.
Does the system completely ensure that there will be no losses in the transmission? Suppose you are monitoring the ECG of a patient and remotely you are monitoring the patient, but every detail is very important. Does it ensure that there will be no losses in the transmission?
That is why we need UFB, because this is the technology that will provide this reliability and enough bandwidth for this operation. So that is why we call UFB a prerequisite for these future services.
And will there be any real-time interactivity with the patients?
Yes, of course, because if we take a look, for example, at telesurgery, then the operation itself is operated by a robot with mechanical arm that has all the medical instruments installed in it, and the surgeon operates this robot through the surgeon control unit, so it's fully integrated.
We're not going to put the system directly into live production before checking it.
So this is very similar to what like MIT USA is designing the wearable live net that they got. It's a live vest that they are designing on it, but they are using a Zorus as a software
like
that will be remotely monitoring the patient.
Even the latest technology, it has flaws. So using UFB, have you considered about issues that UFB may lead to?
Well, as you mentioned, every technology has flaws, and that's correct. But the UFB just provides for platform, and then it's a task of secure implementation to build very reliable services on this platform. So UFB certainly gives us some possibility to build these services, and then it's up to us to make them as reliable as needed.
Last question. Yeah, you take it.
Just wondering, the technology where you were mentioned before, where you can do operations remotely, is that in place currently anywhere? Is it in place currently?
Not in New Zealand, as I know, but in USA, yes.
And in Australia as well.
You can ask another question. We heard from the other group that government is giving priority for connecting schools to UFB. Do we have such priority for health sector?
Yeah, along with education, health sector has the highest priority for UFB deployment.